Chlamydia is a sexually transmitted infection. Chlamydia is, the full name is Chlamydia trachomatis, and it's a bacteria. It can be caught through unprotected sex, so anal sex, vaginal sex, and potentially oral sex also. If men have chlamydia in their penis, quite frequently they can have no symptoms at all. If they do have symptoms, they can have some discomfort when they pass urine, some general sort of irritation around the tip of the penis. And if the infection spreads down into the testicles, it can cause pain in the testicles and swelling in the testicles. If the infection is in a man's anal canal, it can cause pain on sex, it can cause discharge, and sometimes pain on defecation. If the infection is in women, again, it can be asymptomatic in women also, but if it does cause any symptoms, it can cause discharge from the vagina. It can also cause unusual bleeding in a woman, so women can get bleeding in between their periods. In fact, one of the classic symptoms of chlamydia in women is spotting, the bleeding between periods, so anyone who has that really must get a chlamydia test. If the chlamydia infection spreads upwards into the womb and the fallopian tubes in the women, it can cause some problems with infection there, and can cause abdominal pain and potentially abscess formation. And if all of this isn't treated, it can potentially cause scarring and infertility and chronic abdominal pain. So it's really important that people get tested for chlamydia because it is curable. So with treatment, all these complications can potentially be prevented. If you have chlamydia, other than potentially having abdominal pain if you're a woman and fertility problems in the future, and if you're a man, potentially having the infection spread to your testicles and causing testicular pain and potential fertility problems in men. Otherwise, there's no other diseases that, for example, cancer or anything, that you are more likely to get with chlamydia. As with all sexual infections, if somebody catches one sexual infection, they are more likely to catch another. So if there is a patient who has HIV and chlamydia, if they pass on one of those infections, they're more likely to pass on both. So yeah.